Thank you very much. Thank you very much, everybody. I'm sorry for this little problem that we had. The computer did not want to recognize me for some reason, but that's the way it is. Just as a word of introduction, a lot of thanks to you guys. And the beauty of this COVID-19 is that we can get a panel in less than 24 hours in place, and we did it. Everybody's laughing, but this is, we have always to look at the brighter side of the situation. As we move forward, and everybody is aware of this situation, that the number of infections are now declining significantly, and as such, the lockdown becomes a little bit decompressed, I should say, and we're going to be able to advocate and look for ways of entertaining the possibility of reopening and reopening communities, cities, and also campuses of university. And as such, we're very fortunate to have a very, very interesting panel that I've been aware of while I've been at Boston University, but I'm pleased that the speakers have agreed to participate on this panel, and for that, I'm extremely grateful. A lot of thanks also for IT and public relations that worked tirelessly overnight to make sure that the program would be running quickly and smoothly. And as a word of housekeeping for the audience that I appreciate also coming in on a short notice, is that we will have questions at the end of the program. Everybody will speak. We will collect the questions, and I'll select the question to be presented to the speakers. And in the interest of time, we will hope to finish by 1 o'clock if everybody is okay with that. So without any further ado, let me just introduce the first speaker, Jennifer Kismat, former Toronto Chief Planner. She's an urban planner passionate about creating place where people flourish. She was named the most powerful people in Canada by Maclean's, one of the most influential elements in Toronto life, and one of the top women of influence in Canada. She spent 5 years in Toronto as a Toronto chief of city planner, and she's here to help us understand municipality across Northern America. She has planned and planning practice characterized with an emphasis on collaboration, emphasis across sector, broad engagement with municipal staff, council, building. She has all the good stuff that we would like to hear. And without further ado, thank you so much, Jennifer. It's all yours. Please take it away.
Thank you very much, Dr. Amar. What I'd like to just do here is share my screen. So just bear with me one moment and you will be able to see my slides. Thank you so much for having me as part of this conversation today. And what I'd like to speak about is what I've called getting from the now to the after now, which is really about the links between how we design space and how public space is articulated in light of the pandemic, and the things that we can do and the interventions that are required really on 3 key timelines. And those timelines are the right now, the time that comes after right now, the transition or the in-between, and then the third phase, which I've called the new normal. And I should say that it's really critical that we're clear about each one of these phases, because each phase has distinct characteristics and as a result demands a different kind of response from a city planning perspective and also from a public health perspective. And there's a risk if we get the phases mixed up, quite frankly. And this is something that I've seen in the public discourse that's taking place today already, is that there has been some mixing up of these phases. But just as lockdown, which is the now, has certain characteristics, moving out of lockdown has certain responses and characteristics. And we also know that once we have a vaccine, which will be the new normal, will have certain characteristics as well. And being very clear about what phase we're talking about in our public response, in our public health response, in our city building response is going to be absolutely critical to building a shared consensus about how we use public spaces in our cities. There's a risk. There's a risk that there's confusion about what a lockdown response looks like versus what a new normal looks like. And we've been able to generate significant public buy-in into the importance of a lockdown. We're also going to have to generate public buy-in into the in-between phase, the after now. And we will also need to generate public buy-in into the new normal. I'm concerned that if we don't speak about our responses in terms of these distinct phases, it'll be incredibly confusing for the public. And already there is some confusion in the public about what is acceptable and what is not acceptable behaviors. And in part, we have to talk about the moment that we're in. So what I'd like to do in the context of this presentation in the next 10 minutes or so is just walk through each one of these phases and what I think defines each one of these phases. Now, to do so, I'd like to set this up by making the link between public health and public space explicit. Because we know that the way we design our cities is in fact one of the many determinants of health. And we know that cities, for example, that are designed around cars have different health outcomes due to poor air quality, due to higher levels of obesity, diabetes, Alzheimer's, than cities that are designed around walking and public space. Now, this is really critical because when you hear me talk about these three phases, I'm actually going to be making links to changes that we need to make in our cities and our public space in order to drive forward health outcomes, really as a result of our approach to public space. There's a seminal study that was undertaken by the University of Toronto several years ago, which looked at the link between diabetes rates and proximity to corner stores in neighborhoods. And what was so important about this study was that it made explicit that when residents have amenities within walking distance of their neighborhoods, that a whole series of positive health outcomes were a result. We've been talking about staying at home in the now. We've been talking about limiting the extent to which we're in public space. We've been talking about social distancing. There's a risk that as we move into the in-between phase and as we move into the new normal, that some of those characteristics of lockdown actually begin to permeate how we think about cities of the future, which would actually be in contravention of the broader public interest of creating healthy cities. Because we know healthy cities are cities where we have shared public spaces, where active transportation, such as walking and cycling, are the foundation for everyday public life. The images that you see on the screen here are from a proposal in Paris by the mayor of Paris to create 15-minute neighborhoods where it's possible to undertake a variety of activities within walking distance of home. Really, this is about getting rid of the long commute. It's about recognizing that designing cities around cars is not a healthful approach to the design of cities, and that we need to shift back to thinking about the neighborhood scale as being foundational to healthy cities of the future. So this is kind of an overarching idea that will permeate the way I'm about to talk about the now, the after now, and the new normal in my upcoming slides. So first, let me speak here about what characterizes the now. Well, right now we're in the middle of a global pandemic. I think all of us know that. It means we have needed emergency housing, particularly for those who are incredibly vulnerable. It has meant that we've needed to think about adapting our street infrastructure from the design move perspective to being more about pathways for cyclists and pedestrians. Because of the primary importance of social distancing, we've needed more public space. And we've also needed more access to transit. This is really essential Because we needed social distancing on transit, we've recognized transit as an essential service for key workers who are foundational to our healthcare system, to accessing food. And as a result, we've needed more public transit service, not less, despite the fact that there is a significant decline in ridership. Some of the implications of the now. We know we need new funding models. I'll use public transit as an example. If public transit is an essential service, we need to maintain it in the time of a pandemic. But if it is funded primarily through the fare box, and we've seen ridership fundamentally decrease, we need a new funding model, because we're going to have less people taking a service that is essential, that continues to need a very high level of service in order for societies to successfully function. That's the moment we're in right now, which is the now. And I think the now is a phase that is pretty well understood. But there are triggers that are going to lead us to a transition, which is going to be after now. This is an in-between phase. This is going to continue to be characterized by social distancing, physical distancing. It will be characterized by incremental opening. We will be looking for ways to open up our economy, to get people working, but without going back to an environment that existed before. So what are some of the design moves that are needed in this phase? Well, we need new operational measures to access city space. So what I mean by that is there are cities in the world where the approach to the in-between phase has been encouraging commuting on certain days of the week, but not others. So dividing the population up and saying, look, we don't have enough transit for everyone to use transit the way we did in the old world. But what we can do is say on certain days of the week, certain people are encouraged to use public transit. So that's an operational measure. We're not changing infrastructure, but we're putting a new operational mechanism in place that is changing the way people use the city in order to maintain social distancing. If we want to see our restaurants continue to thrive, we need to start thinking about our streets as patios. In Lithuania, public space is being transformed so that restaurants can open, but people can be out in the public realm and safely social distanced as they are dining. That's a design move and an operational measure to ensure that we can manage the in-between phase. And the third point I have here is what I've called instant infrastructure. If we look to Berlin has been overnight laying down bike lanes, knowing that in most of our cities, the vast majority of trips are under 5 kilometers. 5 kilometers are easily bikeable. But one of the reasons people often don't cycle is they don't feel safe. We have less car traffic because less people are getting in their car and commuting every day. And as a result, we can add instant infrastructure for cycling so that people can get where they need to go. They can avoid public transit and prioritize public transit for people who must use public transit because the trip is too long for a cycle. And we can adapt our roadways through instant infrastructure to ensure we can move around the city very safely. Some of the implications of this in-between phase: we need quick action. We can't wait. We will be stuck in lockdown if we don't put these measures in place. And we need to continually be adapting as we learn more about the disease. About the virus, we can actually change the way we move around public space in our city. So the in-between phase will be characterized by political leaders needing to be decisive, moving very quickly, but also making quick changes to infrastructure and how people move around the city. Now, the last phase I've called the new normal. And the new normal is post-COVID-19, when we have a widely accessible vaccine. Now, look, we don't know when this is going to be. We could be in the in-between phase for a very long period of time, which is why it's so critical that we make adaptations in the in-between phase. In-between phase adaptations need to be sustainable. They need to be things that we can do not just for months, but for years. When we get to the new normal, well, it doesn't make sense for us to go back to creating pollution-filled, car-filled cities where we have long commutes, where we're stuck in traffic, where our air quality is compromised because we're commuting by car. So we need to be thinking about planning the city for the new normal. And that means embracing the 15-minute neighborhood. It means neighborhood scaled design. It means shifting to healthier neighborhoods overall that are decarbonized, and recognizing that in the new normal, cycling is foundational to mobility. Cycling isn't a fad. Cycling is going to be the new normal in a healthy city, in a post-COVID city. So some of the implications in the new normal: we're going to need new forms of governance. We will need new housing models that recognize essential workers, frontline workers, key workers need to live closer to where they work. The old model, where we forced affordable housing to the periphery of the city, is a bad model. The new model integrates affordable housing in close proximity to our hospitals, in close proximity to where people are providing services. That old model of assuming a separation of uses and that there will always be a distant, long commute is inherently harmful and problematic. And in the new normal, there will be a new and renewed emphasis on future preparedness, thinking about sustainable approaches to city building that will allow our cities to be stronger, more resilient from the outset, so that when pandemics hit, we have a strong population with clear processes and systems in place that can ensure we will be healthy and safe. So this is a summary slide of these three phases: the now, after now, and the new normal. And the point I can't stress enough is that we need to be very clear about what phase we're in. And the public needs to understand what phase we're in, because we act differently in each of these phases. And in particular, in the after now phase, the in-between phase, we're still social distancing, but we're also moving around the city and living our lives in the city. And getting the after now phase right is really of paramount urgency. Otherwise, we will stay stuck in lockdown. Thank you very much.
Okay, sorry for that. Thank you very much, Jennifer. I mean, today is not the day for technical problems, but apparently we have multiple of them. Very much appreciated those very insightful presentation on the redesign of our new life, especially the in-between and the future of this pandemic. Our next speaker is Joanne Saba. She's a partner on NBBG. She's specializing in healthcare architecture and planning. Joanne brings more than 25 years of expertise and strategic vision on all types of healthcare projects. She has the expertise in translating current and future programmatic and operational need into effective healing environment and applied to a project of diverse magnitude, I should say. She will speak today about the future design of an important concept that is very close to us, the design of hospital and other public spaces, enhancing multiple types of resilience and the ability to live comfortably with another pandemic. Thank you, Joanne. Thank you.
Thank you, Dr. Amar. I'm going to share my screen here, hopefully rather easily. Is that good? Yes? Okay. So it's an honor to be here, and I'm going to share some of my thoughts from the point of view of a healthcare architect, and not really getting into specific design aspects on a small scale, but more focused on what I think we're learning from our experience during COVID-19 and how we start to think about that in terms of our design. So just a bit of background about me. My fascination has always been focused on complex academic medical centers in an urban environment I mean, the mix of research and teaching and healing and how vibrant that is, multidisciplinary teams, everybody coming together, defining an environment where patients and families really have the agency to take care and take hold of their own healthcare. And the way we do that is designing our healthcare facilities for performance, not only the building performance, but for the human performance. And the way that we get to that human performance is designing spaces for experience, and both the human experience individually and collectively in hospitals and designing for health. But especially today, we know that designing for health and health experiences go far beyond the walls of the hospital, and it has everything to do with designing the spaces within our cities that fuel our mental health, our emotional health, our spiritual health, a lot of the things that Jennifer was talking about as well. And that designing these city environments are going to shape our experiences throughout our history. It forges our sense of safety and security and a sense of belonging and meeting. So that's sort of where we're coming from. I'm coming from on this. But now we find ourselves universally thrust into this new COVID-19 experience, no doubt most strongly felt in our healthcare environments within our cities' hospitals and the areas around them. And, you know, as healthcare architects, we're learning how we can apply to our designs different aspects that we're learning from this experience from COVID-19. So I have not 5 answers, but really 5 insights that I take away from what we're living with right now. And I love what Jennifer said for, you know, what we're going to be living in the future and the new normal. So first of all, and undeniably, that there needs to be a stronger link than ever before between public health and design of our cities and the buildings that are within those cities. And I actually marvel at the fact that there isn't a stronger bond between us. Hospitals are often a symbolic beacon with our cities, such as this ambulatory and teaching facility deep in the heart of Beirut. And as such, our hospitals have always been a vital part, again and again, in our response to disasters, natural or not, like Katrina, like Sandy in our city. And we know now how to design and how to protect against them, to be prepared for the next one. And, you know, even those disasters that have changed our lives globally, like 9/11, we've strengthened our airports, we've strengthened our buildings, our utilities against terrorism. We use design to put us in a better position. But as horrific as these events were and are, they had a personal impact comparatively small to people globally. It didn't affect everybody in the world. And I think that's the big difference here with COVID-19, that it can't be engineered or controlled by a built solution, that it's actually, my second insight is that COVID-19 is a level playing field. It's affecting all of us personally, globally, and it's the first of its kind that's being experienced for most of us. And we haven't to date designed hospitals and the support environments around hospitals on this level of magnitude. So there are a couple things that we can clearly do with the design of hospitals. We can design separate fever entrances and circulation within our hospitals for those that are sick. Like this one on the left, it's the Shanghai Hodong Hospital. It's pretty commonplace to do this in China. And this was shot, a picture about 2 weeks ago from one of our colleagues in our Shanghai office. Or we can continue to do what we do today in all of our cities and erect temporary structures to address the magnitude of people that respond to a pandemic. But, you know, actually, I think we have an opportunity to design a better way to manage the onslaught of people during a pandemic, sick or those worried about sick, because that has been a big issue also, those people who are worried presenting themselves, and the experience of those patients and the clinical staff that are serving those patients. So here's a couple ideas. So what you're looking at here on the left, it's a bird's eye view looking down on a campus. And on the right, it's interior courtyard. And these are two facilities that we designed in New Orleans post-Katrina. So one idea is to provide a hospital campus that provides a number of controlled access points into the hospital and outdoor areas where surges of people can be managed in smaller numbers and actually be designed with the airflows to help mitigate transmission, such as these two hospitals. And they utilize a number of intimate courtyards for respite and calm during normal times, but can be utilized and called to action during the pandemic. So that's one idea. The third insight that I have is that we as designers have an opportunity to zero in on designing hospitals that recognize the need for human support of each other that has emerged as a key experience for us all. And actually, none is more felt than the front line of those in our hospitals. And it's interesting during this pandemic that through social media, like a few of these posts that you're seeing in front of you from Mass General and Brigham and Women's Hospital, that their experience are front and center for us, and we are living it and not quite feeling it and living it with them, but we're pretty exposed to it. And it's a great design question for us in terms of designing for those powerful moments. And what is the opportunity? And it takes me to thinking about that this generates a wellspring of the need to show gratitude and the human spirit to show it. And it's interesting to me to think of this idea of the human need for connection during these times of crisis as a driver in healthcare design. So that's another takeaway. The fourth insight is we have to understand what it means to design spaces and experiences that we can live comfortably with during a pandemic, because, and actually in the in-between, as Jennifer talked about, because how we are living now is unsustainable. And even, weeks into this, we know that our hospitals are facing a pretty scary drop in non-COVID care for patients that really need to be seen and really need to be treated, but they're very fearful about going to the hospital, and for a real reason in many cases. So one idea may be thinking about making access and circulation very transparent and clear with signage and wayfinding that can be temporary for patients, families, and staff in the community, so that people can understand that hospitals are providing safe access and safe circulation for ongoing care. So I think this is something that we've learned and we'll be able to utilize in the time ahead. And the fifth insight is all about resiliency. And a lot of people are talking about resiliency. It's a broad word that covers a lot. But I think that the types of resiliencies that we're seeing through our COVID-19 experiences are especially informative as we think about those drivers for design and what's important. So one insight is in the classic sense of resiliency, and that, as Jennifer said, is that our cities have never been cleaner and therefore healthier for a long time. So we have the opportunity as designers to partner with public health officials and policymakers within our cities to not let this aspect of COVID-19 experience plus fall away. People are aware of it, and it's something that we have the opportunity to continue, and we shouldn't let that go. Another is human resiliency. Too many people have died from COVID-19 for sure, but many, many more have survived. And they're enabling us to learn a lot about this pandemic and those to come. So it's making me think about designing for that patient journey with all the emotions and experiences involved in fighting for your life. And how would we think about, and what should we be doing as designers in terms of the environments and the operations that surround those environments for those patients that have, what we hear, have really been experiencing a lot of loneliness and detachment from family members and caregivers just because of the nature of the illness. And as designers, we have a whole new perspective on the clinical workers and the support staff. And for sure, when we design hospital environments and healthcare environments. We do everything that we can to design to support them, but we now have a deeper appreciation of how design can make them feel more safe, how it can, in fact, help to prevent or suppress burnout, and to support them spiritually and emotionally. And burnout has been a big issue. We're addressing it, but I think right now there's a lot more opportunity in thinking about that front and center. And another is material resiliency. We were so unprepared for this pandemic that many temporary structures were built, some unused, thankfully, but all of that would be thrown out. And the same with tons of PPE that didn't have the ability for proper sterilization. So one solution we created is utilizing a modular head wall that can be cleaned, stacked, and stored for future use, perhaps on a consortium basis, like this example that we created, partnered with several federal agencies for rapid deployment and future reuse rather than throwing them away. And what you're looking at is 3 units that could be literally developed and rapidly deployed, certainly in areas such as a convention center. And the way that we thought about this is using a module of a head wall that can be easily delivered to put them together to create a unit. In this case, it's for 15 beds, linking them along each side. And they're solid walls, but maybe one way to think about it is that what if those walls were translucent, that they were like a Lexan sheet that was extremely durable and cleanable, and that allowed safety corridors behind the head walls so that staff were able to peer in and be able to connect to the nurse station that is within each of these units. And that maybe, as we think about community environment, that something very simply could be done in these areas, that even though they're temporary, they are creating a safe community for the staff that are called to work in those areas, and to be able to utilize them and not waste them. So that's another kind of resiliency. However, I think the biggest takeaway for me is that we have a community responsibility to each other, and I'm going to call that a mutual resiliency. And that's acting as an individual within a community. And I think we've learned a lot. For sure, this image from the New York Times a couple weeks ago just captures this idea. And mutual resiliency, it's going to be a challenge in a world with deep habits, traditions, cultures, and the need for celebration and community and for human connection. So the design question is, how can we make this easy for people to abide by in how we think about our cities and our buildings, and have mutual resiliency even be desirable? And if you think about it as well, the question may be, how do we design to support and even invite mutual resiliency? And I think there's a lot to think about in that as a designer. So I'm going to close with this last slide. It's an image of 2 socially distanced friends, and they probably experienced a lot in their lives. And, you know, I wonder what they're talking about. And I like to think that it's reflecting on taking everything that we've learned to date and what we're going to learn over the months to come, and to be able to move forward for a much better environment and design. So thank you very much.
Thank you very much, Joanne, for this very interesting presentation, and for a nation that has survived by being clustered. That's going to be a major challenge to spread them out. And your last slide is very illustrative on how we are going to be prepared. And if it's not this pandemic, we're doomed to have probably others that are coming. And this preparation is very crucial as we move forward. Thank you. Our last speaker is Catherine Lusk. This is my close connection for the university that I've been for about 30 years in the past at Boston University. She's a founding executive director of the initiative on cities at Boston University, where she spearheads a new university-wide program and research, including the Menino Survey of Mayors, Student Government Fellowship. She is also a senior personnel in an NSF-funded Smart City Cloud platform program directed by the famous Harari Institute. I was a member for many years on that institute. And she's in the advisory board of the BU Urban Affairs and City Planning Program. She will be speaking on policy decisions that civic leaders will need to consider to making cities more resilient in continuing on Joanne's presentation. Thank you again. Thank you. Sorry.
Wonderful. Thank you, Dr. Amar. I'm going to share my screen with you now and get started. Let's see. Okay, so as Dr. Amar noted, I co-lead the Initiative on Cities, which is a university-wide research center at Boston University, and we focus on urban policy, studying urban environments, and urban leadership with a particular focus on mayoral leadership. So what I wanted to do was talk about what resilient cities of the future might look like in a post-COVID era, and in particular, some of the ideas and opportunities that I've been hearing and seeing about what we need next from cities and city leaders. The first is a bit of a reality check, and this is relevant whether you're a city or a university that is located in a city or any community. The reality check is that municipal layoffs and service cuts are coming. So the fiscal constraints that cities will be operating under are significantly more dire as they lose property tax revenue, income tax revenue, sales tax revenue. And this was a survey of 2,400 cities, towns, and villages that was conducted by the National League of Cities and the U.S. Conference of Mayors in April 2020. And what you see is regardless of city size or community size, the vast majority of municipalities in most cases are anticipating public service cuts, furloughs of employees, and layoffs. So in a post-COVID era, we can imagine that our municipal partners and our communities are actually going to have to do far more with less. What I want to do is make 4 points about what I see as the opportunities for cities in the future. And the first one is very directly related, but not exclusively related to emerging from COVID-19. And it's something that we haven't yet talked about, and I'm not seeing a lot of discussion on yet. As many folks have noted, we're not out of the woods yet, right? We haven't emerged from the crisis. And so we haven't yet determined how we might need to confront grief together. But looking back to 2013, I was working for then Boston Mayor Tom Menino and was part of his staff here in Boston during the Boston Marathon bombings. And I had the unusual responsibility of actually contending with the temporary memorial that emerged at the site of the marathon bombings in downtown Boston within about a day of that event. And what I learned along the way is that this it's instinctive for us as communities, it's instinctive for us to actually bring tokens of remembrance, to bring elements and things that we want to leave at a site as part of the mourning process, as part of the grieving process. And we want to do this instinctively to sort of pay tribute to the lives that have been lost. But we don't just want to bring things, we actually want to gather in these spaces that emerge in the face of crisis. This is another photo from the Boston Marathon bombing temporary memorial. And what you see here are sneakers, which people from across Boston, across the country, and actually around the world brought as tokens of remembrance, as tribute to the lives that had been lost. And then we had heads of state, we had visitors, we had residents, and we actually had the victims and survivors themselves come and visit this space and draw strength from and spend time here as part of making sense of and confronting their feelings and emotions in response to the tragedy. But these spaces are just one of the ways that in the face of mass tragedy, we make sense of them, and one of the ways that cities and municipal and government officials more generally can help us respond to them. So this photo is actually of President Obama and a collection of faith leaders from across faith traditions here in Boston. And it was an interfaith service that was held in Boston after the Boston Marathon bombings. And the reason these kinds of things are important are because here we had an opportunity where we had Mayor Menino, we had Governor Patrick, we had President Obama, we had our faith leaders. And as a community, we had a moment in time when we had people who were lifting us up, who were giving us these messages of resilience and strength and helping us make sense of tragedy. We haven't had this moment yet, but we also aren't in a moment in time in our nation's history where we have leaders who are necessarily going to rise to this challenge and play this role for us, which makes it all the more important that our institutional leaders at universities and employers, but most importantly, our local leaders and our local and state elected officials play this role. Another example from Boston I want to highlight that we've been seeing a lot of in response to the COVID crisis are financial supports. So the one fund was created within a day, again, of the aftermath of the Boston Marathon bombing. And this was a mechanism by which we channeled the generosity, the financial generosity from people that was emerging directly to the survivors and victims and their families. But the other thing that we saw here in Boston was something created more recently by Mayor Walsh, Mayor Menino's successor. And he created, in honor of the Boston Marathon bombing, One Boston Day. And it occurs every year on April 15th. And it's an opportunity for Bostonians to have a public day of service where we pay tribute not just to the survivors and the victims, but also to the first responders. And it's a way of thanking them and participating together collectively in an act of service in honor of their service to us. I also want to highlight that this tribute paying and this sort of public manifestation of grief happens not just in the face of mass tragedy, but in the face of a much more personal tragedy. Sadly, these are items that were left at the site of a shooting here in Boston just a number of weeks ago of a young woman just at the age of 17. And the reality is that independent of the COVID crisis, tragedy happens every day in our cities. And my hope is very much that we actually emerge from this crisis with a new set of tools and a new set of resources as city leaders to help our communities respond to and contend with grief. The second thing I think cities need to be doing is, as Jennifer noted, as Joan noted, make space for people. So this is an example Jennifer's seen from Toronto. This is a public performance artist actually who created a social distancing machine to prove that we need wider sidewalks, right? To prove the absurdity of trying to walk down a sidewalk and actually stay 6 feet apart from anyone else. And we've seen communities sort of pop up in real time, even now, creating this new infrastructure. So in the city of Milan, this is an example where they said, we're going to reclaim the street, we're going to reclaim the streetscape and create more space for cyclists and walkers, and we're going to reclaim it from cars. And they've already done it. So cities are actually acting now. They're creating a new status quo before we fully reopen so that this infrastructure is in place and becomes the new way that we get around. This is a photo from Florida, where, as Jennifer noted, we see cities, we've seen it in Lithuania, but we're also seeing it here in the United States. We see cities actually close down streets and use those to allow open air dining, which is a safer way for folks to actually begin to sort of reemerge, for the economy to reopen, and for us to take advantage of dining out. This is an example from a friend in Treviso, Italy, which is just outside Venice. This is actually their open air market, which is one of the primary ways that they sort of buy in her community, that they buy goods. They've reopened the market, but they've really been focusing specifically on agricultural products, sort of gardening, and food. So the typical vendors you might see in a public market in Europe are actually not there. They've really been prioritizing sort of the necessary things that people really need, so that they're creating far more space for those folks to actually be out and take advantage of outdoor shopping. The one other point I want to make about making space for people is that independent of the COVID crisis, we have to be doing a better job of creating safe spaces for cyclists and walkers, and creating safe spaces for people in the public realm, in the urban realm. So over the last 30 years, this is just data on US pedestrian fatalities. And in the last decade, the trend has been pointed in the wrong direction. We are seeing a dramatic increase in pedestrian fatalities over the last decade. The same is actually true if you look at data on cyclist fatalities. So there's an urgency to these interventions that is not just about the need for physical distancing, but is also about the current threats that are posed by our design, by our communities in the way that they're presently been designed. So as part of making space for people, the very first thing is widening sidewalks, creating new dedicated bike lanes, but also increasing transit frequency, devoting more space to open air markets, and select street closures with a prioritization for those neighborhoods at greatest risk. The second, and I haven't seen a lot of this yet, is really surveying residents, not just health officials, but surveying residents to understand the sources of their risk and anxiety. Which residents feel vulnerable and where, right? I have a different sense of anxiety when I leave my house than someone in another neighborhood in the city of Boston. Maybe it's commuting, maybe it's shopping, maybe it's waiting at the bus terminal. And this isn't just about the COVID-19 crisis. This is just about public health and the responsibility that, that urban planners and city leaders play in trying to protect and promote health in the public realm. Next, recognize employers for formalizing work from home policies, staggering hours, investing in bike parking and electric vehicle charging, right? Creating multiple ways for us all to get to work, and rewarding employers and recognizing employers who formalize work from home policies and are giving people alternatives. As the CEO of Twitter just announced, they are now going to allow everyone moving forward to actually work from home. And lastly, we need city leaders to be really focused on making home a healthy space. We're all spending a lot more time at home now. We are probably going to continue to spend a lot of time at home in the future. We always have. We need to do a better job of anticipating summer heat waves and cold snaps, and we need more municipal leaders to be investing in energy efficiency, home energy audits, and also having alternatives when home is not a safe and healthy place, right? You hear this from police officials who say they've seen a significant increase, not just in home-related COVID transition, but also tragically in domestic violence. As we're at home, as our anxiety levels are high, home is not a safe space for many reasons for many people. We need municipal leaders also to focus on clearing the air, right? We've seen the clear sky photos over Mumbai and LA. This is from Europe, looking at NO2 levels between 2019 and 2020. We don't want to regress. If you talk to any environmental leader, they will tell you, do not regress. We have to be doubling down on decarbonization and energy efficiency. And we have to be focused on clearing the air and improving air quality. That means investing in green infrastructure, putting trees where they aren't, and keeping those that you have, like we're seeing in Cambridge, Massachusetts. A continued focus on decarbonization, buildings and transit, but also municipal fleets, so that as cities are spending those scarce dollars that they have, they're being focused on school buses and buses that are electric vehicles. Also an orientation toward active transit and e-mobility options that are they need to be more widely accessible. And this isn't just about electric vehicles, which has been the topic of much discussion. Your community, like my community at BU, probably doesn't have enough electric vehicle charging stations, but it's not enough to just be talking about EVs. We also have to be talking about e-bikes and scooters. And in particular, cities have an opportunity to educate and engage diverse communities on the routes, the rules, and the resources. Do I need to be wearing a helmet? Where can I safely ride this? What are the resources and rebates that are available to me to make these kinds of purchases? And lastly, Jennifer mentioned this as well in her remarks, a reorientation toward living local. I am incredibly fortunate where I live in Boston. I can leave my house and I can walk to Parks and Green Space. I can still walk to the grocery store. I can walk to the dry cleaner if it were open. We really need this orientation toward 15-minute neighborhoods. So that means zoning that allows for mixed-use development and walkable, bikeable streets such that the majority of our daily needs are actually within ready access without having to get into a car. And lastly, we need local leaders to be communicating clearly with all residents and inspiring confidence. One of the things that I think has been really gratifying to see as someone who cares about mayors and mayoral leadership is the extent to which they're going to reach communities that aren't on Twitter, that aren't reading the newspaper, that likely do not have English as a primary language, to reach communities that typically do not hear from City Hall. And my hope going forward for resilient communities is that we see more direct and inspiring communication from those local leaders to all residents, regardless of the channels they're using, regardless of the language they're speaking. And I'm going to close it out with that, and I'm going to turn it back over to Dr. Amar. Thank you.
Thank you very much, Catherine. Very much appreciated. We have few minutes for the panel for some questions, and I'm going to take the prerogative of the organizer of this symposium to ask a question to all the speakers, and it relates to a couple of issues that are very close to home, but still an important aspect of living in city and community. If anyone can comment on how should we prepare ourselves in regard to student housing? You know that, and at BU, you have that. It's usually extremely crowded. What are your thoughts about this concept? And especially, I've heard the word to decompress, to give space, etc. That's going to be an issue when it comes to places with prime real estate. Boston is a prime real estate. New York also, and the emergence of this pandemic and the incidence has been huge over there. How are we going to react and being able to help when the real estate doesn't afford for decompression?
You want me to take that?
Please.
Dr. Barr?
Anyone.
Joan, do you want to respond to thoughts on the campus community?
One thing that we've heard across the country, and I don't know how uniform it is, but there have been mostly independent hotel chains that are actually partnering with universities and colleges, since their usage is so low, to be able to spread those students throughout those buildings. So that's something we've heard. Ladies, you're nodding, so I'm wondering if you've heard the same. Yeah.
Mm-hmm. We've heard that here as well, and I've actually seen it. I've seen it in action in prior years in Boston, where many universities, not BU, but other universities, have been slow to build the necessary dorm rooms. And so even in years past, we've seen universities here in Boston partnered with hotel chains to buy out whole floors of the hotel and reallocate all those rooms to students. So I think we'll certainly see more of that. In the COVID era, we're also seeing that most folks know that Chelsea here in Massachusetts, the community of Chelsea, has been incredibly hard hit. It has serious, about 60% of that community is immigrants. Most of them are renters. There's severe overcrowding issues. So Chelsea and Revere have actually banded together to buy out a Quality Inn. And the Quality Inn is specifically staffed with nurses and medical professionals. And then those rooms are available to residents of Chelsea and Revere who don't need to be hospitalized, but are otherwise in overcrowded or unsafe living situations and are not able to stay at home and have been afflicted with COVID.
I'll just add that in keeping with the comment that both Catherine and Joan just made, that the principle here is one of adaptation. And what we're seeing is that the usage of some things has escalated, and we've needed more space. And then there's other things like hotels that are sitting completely empty. And so if we take the principle of adaptation to every problem that we have, essentially we have to see the infrastructure that we have, whether it's streets or hotel rooms, and ask the question, how can we adapt the infrastructure that we had in the past to meet a need for the future? We can assume that going forward into the near future, there's not going to be a lot of travel taking place and people going into the travel industry. So that raises this question of how those spaces get adapted to provide living spaces where there's compromised living spaces. In the city of Toronto, the city has created a partnership with hotels, and it's amazing what a crisis can do. We've moved very quickly to get people out of shelter spaces and people off the streets into homes in apartment buildings and hotels that were underoccupied. So this principle of adaptation is, I think, going to be a key driver for how we solve the challenges that we face in places like university dorm rooms, but also on streets and on transit.
Just came on the screen. Yeah, what are your thoughts regarding many buildings, and definitely academic buildings have windows. Sometimes they can be open, sometimes they cannot be open. Is it the opinion of this panel that the windows should be left open and being able to be opened?
I'll start on that. I certainly personally think that they should be able to be left open. This is where I think we're going to learn a lot about our codes that we have, and building codes and mechanical and heating and cooling efficiencies that have been achieved by shutting up and closing our buildings so that you can't do that. And, for example, our hospital buildings in the United States, you are not allowed to open a window because you want to control that environment, where in Europe they are able to open their windows. So I think there's going to be some learning from that, Dr. Amar, as we look forward. Adaptation, I think that's the word, right?
The buzzword today is resilience and adaptation, I guess.
Yes.
Nice word. There's a question, many older hospitals have chapels that used to be used for worshiping. Do you anticipate to have that repurposed for any other aspect that you would see fit, and maybe to prevent burnout?
Yeah, I think absolutely it can be. And I think what that's going to do as designers is we're going to be thinking about multi-use for spaces, not just like a chapel, but for anything, and how we think about that for it to be flexible. And I mean, even during this crisis, our firm was tapped to look at some of the cathedrals in the city to see if some of them could be utilized. So it's a different mindset. And I think that's a great question about having that mindset of a future flexibility in spaces.
Questions. One last question that us as planning for the educational programs that are coming, hopefully late summer, beginning of the fall. How do you think, what are your thoughts of having big tents that are usually put for graduations and stuff like that, being out in the open with some partitions, just like Joan, what you presented them on beds in the hospital, but being purposed specifically for small group education?
I don't see why not, but.
Well, I would, just go one step further and say that in the in-between phase, those are exactly the types of solutions that are going to be critical to making a transition. Otherwise, we will be stuck in lockdown before we have a vaccine.
Correct.
So some summer camps are looking at that as well for dining. We know that in the in-between phase, we have to ask the question, how can we begin resuming some activities as normal while still social distancing? And what that means is we need more space. The new normal phase is a completely different ballgame, and you're not going to have tents as part of the new normal. But in the in-between phase, it's actually an excellent solution. Most universities have access to tents. They have large public spaces where those tents could go up, and they could create an incremental approach to being able to deliver in-person services or labs by using that type of infrastructure.
First, thank you, Catherine. Thank you, Joanne. Catherine had to go to another meeting, and I knew that we need to keep the program to exactly 1 hour, but I wanted to reiterate my appreciation and my gratitude for you guys coming forward on a short notice to enlighten us. Thank you again, and I wish you all the best. Stay safe and continue this wonderful job. Thank you.
Thank you.
Our
Thank
pleasure.
you very much.
Thank you.
Bye-bye.